All right, good afternoon. Welcome to the House Health Committee voting session. Well done. We have this is voting list number 6. It is Thursday, March 12th, and we are going to start with our withdrawals. All right, they've been moved and seconded. Is there any further discussion on the withdrawals? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, seeing no opposition, we're going to move to House Bill 1076 because this is Lisa's only bill on this list today. And we are second on this bill. So this is the Higher Education Institutions Over-the-Counter Contraception Access and Reporting. Lisa, if you want to tell us about the bill and what happened in appropriations.
Each public senior four-year higher education institution and each community college to submit an annual report on campus over-the-counter contraception access to the Maryland Higher Education Commission beginning on September 1st, 2026. The report must include how access is provided, whether institutions have provided access to all methods of over-the-counter contraception, the amount of over-the-counter contraception provided, and a description of how the institution or community college has consulted with students and student organizations about providing over-the-counter contraception on campus. By October 1st, 2026, and annually thereafter, MHEC must submit a report of the information to the General Assembly. The bill also specifies that community colleges must provide students with access to all methods of over-the-counter contraception and consolidate existing reporting requirements into the new requirements. So appropriations voted on this last week, and it was unanimous. There were 2 excused and 1 absent.
Do we have a motion on the bill? Move the bill. All right, it's been moved and seconded. Is there any discussion? Delegate Shalega.
Is there a provision for religious schools that don't want to participate? They may have a religious position on this issue.
I don't think there is one in the bill itself, but my guess is there is a provision elsewhere.
And then my second question while you're looking for that is, I read the fiscal note, MHEC advises the bill adds to the agency's administrative responsibilities and when combined with other recently enacted legislation may require additional personnel. So did anybody discuss the fiscal note? Is it another person or?
Not that I'm aware of.
Thank you.
Thank you, Delegate Shalega. I will point out that it passed unanimously from appropriations, so I would posit that if there was a concern about the fiscal note, I hope that they would be the appropriate committee to consider it. Are there any other questions or discussion on this bill? Seeing none, we did have a motion. All in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Delegate Shalega, Delegate Morgan, Delegate Hutchinson, Delegate Riley. All right, thank you very much. So, and thank you to Lisa, who's going to go and prep for our vote list tomorrow. All right, so we are now going to move on to House Bill 410. This is the public health food and milk product labeling requirements. This is Chris and Hill.
Establishes new requirements regarding labeling of food items and milk products for human consumption and prohibits the sale of items labeled with a sell-by date that do not meet such requirements. Beginning July 1st, 2027, a food manufacturer, processor, or retailer and a grade A milk plant or processor must use specified phrasing to indicate a quality date or safety date on any food item offered for sale. The bill's labeling provisions do not apply to infant formula or beer and other malt beverages. By July 1st, 2027, MDH must create and post on the department's website educational materials to inform consumers about the meaning of quality and safety dates and adopt regulations to carry out the bill. There were a couple of amendments. Amendment number 1 is technical, and the amendments are pages 1 through 7 on your packet. Amendment number 1 is technical. Amendment number 2 adds an exception for dietary supplements, pushes the compliant dates out an extra year, mandates the department creates educational materials in conjunction with certain organizations, and removes milk products from the bill.
Delegate Hill.
The amendments were accepted unanimously. The bill was not. The opposition of the Consumer Healthcare Products Association at the milk amendment, they were okay, but the retailers were not. They still don't like the bill. And so the bill ideologically passed, 1 absent, 2 nays, and 4 for. So move the amendment.
Is there a second? All right, it's been moved and seconded. Do we have discussion on the amendments? Delegate Kipke.
Thank you, Madam Chairman. If you go to a large retailer like Walmart, you see big national branded products primarily there. And I suspect that many of those companies are big enough and sophisticated enough that they could perhaps comply with this. But if you go to Mom's Organic Market or Sprouts, your local health food store, many of the products that are in those types of places are smaller companies. They're not big national, Frito-Lay, they're small or, companies trying to feed a niche of, food that is potentially healthier. So what I'm wondering is, if you have, let's just say some protein bar that's being manufactured in North Carolina, might the requirements of this bill with these amendments preclude a company like that, buying the company like that into a situation where they might not be able to sell their products in the state of Maryland? I mean, they're not huge like Frito-Lay where they could have sophisticated computer systems, and there's a patchwork of different rules and regulations in different states. Might it just be too cumbersome or burdensome for them to comply with this?
Delegate Hill.
Thank you for the question, Delegate Kipke. Actually, I think not. So this sort of harmonizes the number of different kinds of sell-by dates. Remember that even small businesses, local businesses, have to put a sell-by date on everything, whether they call it use by or best by or whatever they call it. So they're stamping these things anyway. And they can, for instance, if Maryland and other couple of states are using this, there's nothing to stop them from using this same date that we're asking for in the other states. So if they're using sell by, use by, whatever, and we ask them to do this, they can do it here, and they can also do that in the other states that don't care what date they use.
Are there any further discussion on, we're still on the amendments. So, Delegate Shalega.
So the amendment that we're on the amendment that takes out beer and baby formula.
The only thing that was taken out of the bill was milk products.
Milk product,
There
okay.
is an exception for infant formula, beer, malt beverages, and dietary supplements with the
Okay.
amendment.
So we're on the amendment that takes out milk products.
Correct.
Okay, I'll ask my questions after we adopt the amendments. Thank you.
Do you want to just explain the amendments one more time, just so we make sure we're all on the same page on the amendments?
Sure. So the amendments add an exception for dietary supplements. It pushes the compliance dates out for an extra year. It mandates that the department creates educational materials with specifically the University of Maryland Extension and food donation organizations, and it removes milk products from being subject to the bill.
Thank you very much. Is there any further discussion on the amendments? All right, they've been moved and seconded. All in favor, say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, do we have a motion on the bill as amended? Second. All right, it's been moved and seconded. Is there further discussion on the bill as amended? Delegate Shalega.
Thank you. So this is instructing the University of Maryland Extension to develop a pamphlet or something and post it on their website. Is that it? Do they have to give it out to grocery stores or?
Delegate Hill, Chris. Looking both ways, sorry.
The only mandate is that the department post it on the department's website.
Okay, well, I'll just make a comment. Do you really think anyone's going to look at that? But secondly, how does this affect the cottage food industry? For instance, many of us go to the Senate canteen, and someone over there is making what looks like to be delicious cookies, which I haven't eaten yet, and there's no sell-by date on that. Are we going to now make, you know, the cottage food industry have to adhere to this? Or they can give their food to a food bank?
The bill currently says a food manufacturer, processor, or retailer responsible for the labeling of food items. So if a cottage food maker is not required to label it, then they're not subject.
Okay. All right, thank you.
Delegate Johnson.
Thank you, Madam Chair. I just had a little to add on that, being in that business before. If you pick it off a shelf with your hands, then it has to have a label on it. But if it's handed to you, like over in the Senate Cantina, then it does not.
Learn something new every day. I did not either. Is there any further discussion on the bill as amended? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley. All right, this bill is amended. Who does not want to be on this bill? Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley. All right, thank you very much, everyone. We are now on House Bill 769. This is State Board of Social Work Examiners Conditional License to Practice Social Work Revisions. This is Lindsay and Rosenberg.
So as originally introduced, this emergency bill would have repealed the authorization for the Board of Social Work Examiners to issue a conditional license and instead required the board to issue a conditional license to an applicant who, except for passing a required examination, has otherwise met the appropriate education and experience required. And then the board would have been required to issue a full license to a conditional licensee who has achieved a satisfactory score on the required examination or completed at least 1,500 hours of specified supervised experience. The amendments that begin on page 8 in your first packet, adopted in Health Occupation Subcommittee, retain existing provisions regarding conditional licensure and instead add new provision requiring the board to issue a provisional license beginning November 1st, 2026 to an applicant who's met the appropriate education and experience requirements for a license to practice bachelor social work or master social work except for passing the exam. The provisional license requires the holder to practice under supervision, expires on a date set by the board between 12 and 24 months, and may be renewed for up to 24 more additional months. The amendments also specify that a provisional license does not qualify the holder for a multi-state license under the compact, removes the option to qualify for full licensure with practice hours. So your only option is to pass the exam. Specifies that supervised hours under the provisional license may be counted toward the supervised experience required for independent practice approval and may be counted towards qualifications for a certified social worker clinical license, and the amendments alter the timing and content of the annual report.
Delegate Rosenberg.
Yes, the one significant remaining issue of dispute here is this bill, as does the Senate bill, retains the test, and there is one advocacy group that asked us in the subcommittee to vote no on the bill because this test is still would still be part of the law. But it's our understanding that the bill any bill with that language in it would not survive the Senate, where the bill passed out of the Finance Committee unanimously, keeping the test. And so we chose to move forward in a way that will get a bill, and the reforms has been outlined by council, that the bill would make would become law and would deal with the test issue at some other time. And the vote in subcommittee was unanimous?
It was unanimous with 3 members of subcommittee absent.
Right. I will add that usually our Republicans have very good attendance and get extra stars for that. But at this meeting, for some reason, you guys weren't there. So that will be reflected in the discussions we have today, I'm sure.
Did you want to move the amendments?
Yes, indeed. Thank you, ma'am.
All right, the amendments have been moved and seconded. Is there further discussion on the amendments? All in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Do we have a motion on the bill as amended? So moved. All right, it's been moved and seconded. Is there further discussion on the bill as amended? Delegate Riley.
Yes, yeah, I was one of those tardy ones, I'm sorry. So just to clarify, so we removed, I heard you said the exam was still there, so we removed the option of an additional exam pathway, right? So that's gone. The new pathway that the original bill had?
So the original bill would have allowed full licensure with 1,500 practice hours in lieu of the exam, and that was removed.
Okay, so that was removed. Okay, and you only had still the one opposition, and that was because of the exam was not in the bill, and we just added that back in. Okay, thank you.
Member. Okay.
Is there any further discussion on the bill as amended? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. And is there anyone who does not wish to be on this bill? Delegate Shalega, Delegate Kipke, Delegate Hutchinson, Delegate Riley, Delegate Morgan. All right, thank you very much. House Bill 771, this is Health Occupations Human Trafficking Awareness Training. This is Lindsay and Rosenberg.
This bill requires each health occupations board to adopt regulations that permit an applicant for license or certification renewal to receive continuing education credits for completing an approved human trafficking awareness training program and conduct outreach to make individuals aware of human trafficking awareness training options. The bill also required MDH, in collaboration and consultation with required stakeholders, to approve the required training program by July 1st, 2026, and then each health occupations board must adopt regulations necessary to carry out the bill. The amendments that begin on page 15 in your packet adopted in Health Occupations Subcommittee requires health occupations boards to allow an applicant to receive continuing education credit for human trafficking awareness training rather than requiring the boards to adopt regulations to that effect, but requires the boards to adopt regulations that carry out the section in general. Further, the amendments require the boards to adopt regulations by January 1st, 2027 rather than by October 1st, 2026.
Delegate Rosenberg.
This was unanimous among those present, and my best recollection, there was no opposition at the bill hearing. So I would move the amendments.
All right, amendments have been moved and seconded. Any further discussion on the amendments? All in favor say aye. Oh, sorry. Delegate Shalega.
The bill, not the amendment.
No, on the amendment, so you changed it from a shall to a may? Is that what you're saying? It was, you had to take this class, now you're saying you may take this class?
It's not actually requiring the class at all. It was requiring them to allow continuing education credits for if they do take the class. And it is still required, but the health occupations boards were the ones required to adopt regulations that allow for this, and now they are just asking to allow an applicant to do it rather than necessarily having to adopt regulations to do so. It's a very fine change that was requested by the health occupations boards to do with how they adopt their regulations, basically, so that they could do a policy as opposed to regulations.
So do they, now still have to take this training?
Wasn't required under the bill, and it's not required now. It's just that if they that they could receive continuing education credits for completing human trafficking awareness training program.
So what's the fiscal note now? I mean, there has to be a fiscal note. You can't create a program and not pay for it.
Regulations for continuing education credits.
Okay,
So
thank
it's
you.
existing resources.
They support the bill, so it's a good fiscal.
Is there any further discussion on the amendments? All in favor say aye. Anyone opposed, go ahead and raise your hand. All right, on the bill as amended. All right, it's been moved and seconded. Is there further discussion on the bill as amended?
Go ahead, sorry, Matt, you do it.
Delegate Morgan.
Thank you, Madam Chair. I do have a little concerns over this because at some point, some of this training that we're going to acquire for continuing education should be in the field that the license is in. And if it's required training, it's not required? Not required. So what does it do? It just allows if somebody takes it as an elective, those hours count for your CE? How many hours does an occupational license, health license take? I mean, what is their CE requirements?
I mean, I don't know offhand what all of the health occupations CE requirements are. I know physicians is 50 hours. It depends on the professional. And not everyone requires CEs either.
Okay.
Delegate Shalega?
Yes, I would point to the testimony that we have from the Board of Physicians that I think is cautioning this body on doing this kind of thing. Utilizing the existing renewal requirements for continuing ed will allow practitioners to select education most relevant to their specific field of medicine and specialty instead of emphasizing specific training that may not be applicable to the specific field or individual. So I appreciate that it's not a mandate, but I think it then becomes just another bill about nothing. So thank you.
I appreciate that, and respectfully, I also appreciate the sponsor who has been very passionate about human trafficking and in finding ways to ensure that every profession had eyes on people who were in distress. So, Delegate Morgan, followed by Delegate Shalega.
Yeah, I'm just looking at it. I mean, look, I'm probably going to vote for this bill. But it is getting a little bit annoying that so in this one field, we force commercial truck drivers to do it, everyone in education, innkeepers. I'm going through the fiscal notes. I mean, hairdressers take this, and now we're going to enforce it on, or I guess part of their CE training for doctors. And at the same time, the greater policy from the General Assembly is if you had somebody in custody of human trafficking, you wouldn't call ICE. That's the policy that we passed. And it is becoming a little bit a stretch, where it is virtue signaling that we're going to force it on medical professionals. I mean, does anyone really think that a doctor doesn't know what human trafficking looks like? And we're really going to force like a surgeon, like the surgeon that did my surgery, are we going to force them to take an hour of their time to do this training and not something that involves in the medical field? And I think that's the angst that I have on this. So thank you,
And I
Madam Chair.
appreciate that, and thank you. I just will remind the body that this is not a mandate, so we just want to make sure that we are accurately representing what the bill doesn't require. Let me go to Delegate Hill and then Delegate Shalega.
Yeah, I was just going to say that as far as CMEs are, you have to take 150 of them in 3 years and having a variety to choose from, and you pick the ones that are going to do it. And And the whole thing about human trafficking is one of the reasons it's a problem is because people don't even know what to be looking for. And so you're seeing signs often that you don't recognize are signs. It's just like abuse and other kinds of things that tend to be societal harms that are pervasive and that are quietly kept. If you don't know what you're looking for, you don't know what you're missing, so.
Delegate Shalega. Oh, and then Delegate Tabatis.
Thank you. Your comments back to me about the sponsor, I am very fond of the sponsor. This is not personal. Well, it was the way it came out. So I'm very fond of the sponsor. I know she is very passionate about this issue. My voting against this bill has nothing to do with either of those. Thank you.
Thank you for clarifying, because if that was your perception of my comments, that was not at all what I intended, because I actually appreciate the dialogue, as you know. Delegate Tavet.
Thank you, Madam Chair. Well, just to recognize that I think that many more people should be taking this type of awareness. I mean, I've had experiences with police that don't know that when I'm dealing with a child that's been trafficked, they're like, oh, that's just a bad child, a bad apple. It's not. And so as someone I was 12 years old when somebody approached me to try to traffic me. So this is something that if you don't know and you're not streetwise and you fall, God help you.
Delegate Morgan.
Thank you, Madam Chair. I'm
And
also
then
speaking to the
Delegate
greater
Rosenberg.
policy that we passed earlier this year. So look, we've had numerous amendments on the floor this year dealing with human trafficking, dealing with sexual offenders, and dealing with ICE. We've passed 5 bills through this General Assembly dealing with that, and that actually cracked down on the people committing the crimes. It wasn't forcing training on anyone or anything else. So it does seem a little odd that we would go against that, but then do this. That's my point.
Delegate Tabatis. Delegate Rosenberg is next. Thank you.
Thank you, Madam Chair. I just think this creates a greater awareness, which is hopefully potentially preventive in nature and is removed from certain other political issues. Thank you, Madam Chair.
Thank you. Delegate Tabatis.
Thank you. I think that I respect what you have to say, Delegate Morgan, but I think that you have an inherent assumption that the individuals engaged are foreign. That's not always the case. And I think that, like somebody said, we've got our plenty of our homegrown. So I just want you to be sensitive to what's being, to how you're thinking about this, because I do think that this is a helpful bill. Thank you, and we should support it. Thank you.
Delegate Morgan.
Earlier.
All right. Seeing no further discussion, and thank you for the discussion. Thank you for keeping it civil. And again, we know that we do a lot. And this committee sometimes has to work in isolation to the whole picture. So we have a motion on the bill as amended, correct? We moved the bill, or we moved the amendments. We voted on the amendments. We moved the bill as amended. Delegate Hill, did you?
To correct the record.
Okay, go ahead.
Delegate Morgan, you said to force training. And I just want to point out, as the chair said, there's no mandate. This is a may. This is not forcing training on anybody. And so I just want to correct that record.
And we did already correct the record on that.
They actually said. So it is forced training to a degree. Now, it is elective that you can take, but you said yourself, you have to take 150 credited hours. So those hours have to be filled with something. If this is just one of the electives, I'm fine. Like I said, I'm going to vote for the bill. But at some point, you are forcing people to take some of these social programs And I just think that if you're going to force people to take a continuing education class for licensure, for the ability to work, to improve themselves, that's the whole theory behind this, it should be relevant to the license they hold, which is medical.
And thank you for the discussion, and you know, this is going to be a choice that our continuing ed folks can opt for if we pass the bill. So we do have a bill as amended. We do have a motion on the bill as amended. It has been seconded. We have had an excellent discussion. And so all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Delegate Shalega? Thank you. Anyone who does not want to be on this bill? Delegate Shalega, Delegate Morgan? All right, thank you very much for the discussion. We are now going to move to House Bill 838. Delegate Alston?
Thank you, Madam Chair. Colleagues, just want to give a gentle reminder that we really shouldn't impugn each other's motives about how or why we're voting for or against anything. So that's just a friendly reminder from your local parliamentarian. Thank you.
Thank you, Madam Parliamentarian. Very much appreciated. And we also have to remember that not only is the vice chair watching, but so is our future baby delegate. House Bill 838, this is State Board of Pharmacy Prescriber Pharmacist Agreements. This is Lindsay Ann Rosenberg.
This bill authorizes a pharmacist to enter into a prescriber-pharmacist agreement to treat an opioid use disorder using controlled dangerous substances drug therapy if the pharmacist individually registers with both OCSA and the DEA, completes any required training, and follows a specified protocol. The protocol authorizing CDS drug therapy must require the pharmacist to request relevant data from PDMP before initiating or modifying the CDS drug therapy. The bill also repeals specified authorizations and requirements related to prescriber-pharmacist agreements. The amendments that begin on page 18 in your packet, adopted in Health Occupations Subcommittee, alter the definition of authorized prescriber for the purpose of authorizing licensed certified midwives to enter into therapy management contracts. Oh,
Delegate Rosenberg.
Okay, sorry. No, I was just going to say that this
Go ahead.
passed finance with the same amendments, 10-0.
Oh, thank you. Delegate Rosenberg.
These amendments were, I believe, offered by the sponsor, were certainly supported by the sponsor, and everything was unanimous within the subcommittee, both on the amendments and the bill. So I would move the amendments.
All right, amendments have been moved and seconded. Is there further discussion on the amendments? Delegate Riley.
Yeah, I'm not sure if it's on the amendment, but I do know in my notes, I said that the State Board of Pharmacy opposed this. Is this, are one of those amendments theirs? Do you know?
The amendment came from the American College of Nurse Midwives.
Okay, yes, I see that one. They were favorable with an amendment. So the sponsor took out the midwives, correct?
It's actually adding them in
adding
to the
them in,
definition of
okay.
authorized prescriber.
Okay, but nothing with the State Board of Pharmacy.
See them, they're on testimony. They're on testimony from.
I don't know, I got unfavorable.
This bill.
Oh, did not, okay, all right, thank you.
Any further discussion on the amendments? All right, seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, do we have a motion on the bill as amended? All right, it's been moved and seconded. Any further discussion on this bill as amended? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, who does not want to be on this bill? All right, thank you very much. House Bill 922, this is Behavioral Health Administration, Behavioral Health Program Relocation Regulations. Chris Anhill.
This bill requires the Behavioral Health Administration, BHA, to adopt regulations that authorize a behavioral health program to relocate to another site. The regulations must provide an expedited approval process for the relocation of an existing behavioral health program, separate from the application process for a new program, authorize a relocating program to use documentation previously submitted to BHA if the documentation is unchanged or not relevant to the relocation, authorize temporary approval for a relocating program to begin practicing in the new site upon determination by BHA that the new location meets safety standards, authorize BHA to consider the program's regulatory record as a basis for streamlining the review and approval process for relocation, and require BHA to provide clear timelines and standards for the review and approval process for relocation. And there were no amendments.
Delegate Hill.
All right, thank you, Madam Chair, and thank you, Chris. There were no amendments. Opposition is still opposition, and it was voted out unanimously. I move the bill.
All right, it's been moved and seconded. Is there further discussion on this bill? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, it passes unanimously. There is no, oh my goodness. There are no amendments, so there's no, struck that from the record, thank you. House Bill 975, this is health occupations, massage therapy, advertising. This is Lindsay Ann Rosen.
Let's see, then what does this bill do? It specifies that, as amended, the bill specifies that if an advertisement lists the name of the licensed massage therapist or registered massage practitioner, the name on the advertisement must be consistent with the name on the license or registration issued by the board. The bill prohibits a licensed massage therapist, registered massage practitioner, or third party from advertising massage therapy services, stating that prostitution, escort, or sexual services are available on a website known for advertising prostitution, escort, or sexual services, or indicating or implying that sexual activity is part of the massage therapy service. Regulations adopted by the State Board of Massage Therapy Examiners must define specific prohibited language and content for advertising and establish procedures for reporting violations. The amendments that begin on page 21 in your packet adopted in Health Occupations Subcommittee require that if an advertisement lists the name of the licensed massage therapist or registered massage practitioner, the name on the advertisement must be consistent with the name on the license or registration issued by the board, and add a requirement to remove any physical sign or billboard that violates the bill that is placed before the bill's effective date and is visible to the public by May 1st, 2027.
Delegate Rosenberg.
Both the amendments and the bill were unanimous. Move the amendments.
All right, amendments have been moved and seconded. Is there any discussion on the amendments? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. On the bill as amended.
So moved.
Second. All right, it's been moved and seconded. Is there further discussion on the bill as amended? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Who does not want to be on this bill? Delegate Shalega, Delegate Morgan. All right, thank you very much. Did Kipke? Okay. All right. Delegate Hutchinson, Delegate Riley. Let me do that one more time just to make sure I've got it right. Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley. All right. Thank you very much, everyone. House Bill 984. No, it's not. It's 986. Oh my goodness. Nurse licensure, educational requirements enforcement. This is Lindsay Ann Rosenberg.
This bill requires an applicant for licensure by endorsement from the State Board of Nursing to provide adequate evidence, including official transcripts, that the applicant's educational credentials meet specified requirements. The bill also expands disciplinary grounds on which the board may take disciplinary action against an applicant or licensee to include failure to complete specified educational requirements. The amendments that begin on page 24 in your packet strike from the bill provisions relating to the nurse licensure compact.
Delegate Rosenberg.
This was not controversial and was unanimous, and I would move the amendments first.
All right, the amendments have been moved and seconded. Is there any further discussion on the amendments? Seeing none, all in favor say aye. Aye. Anyone opposed, say, raise your hand. On the bill as amended. So moved. All right, it's been moved and seconded. Is there any further discussion on the bill as amended? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, that passes unanimously. Who does not want to be on this bill? The 986. Delegate Morgan? All right. House Bill, what? Do you want to be on it? Okay, so let the record reflect. 986 is everyone is on the bill. House Bill 1004. Hey, I appreciate it. Like, I want to keep us all honest. Public health, the prohibited ingredients in food. This is Chris Anhill.
This bill prohibits a person from manufacturing, selling, delivering, holding, or offering for sale food that contains any ingredient or additive that is prohibited for use in food under regulations adopted by the FDA or any other federal law or regulation. Violations are subject to existing state, criminal, and civil penalties. The bill takes effect July 1st, 27. There was one amendment to strike the list of ingredients that was included in the bill and include a catch-all for any ingredient or additive prohibited by the FDA.
Delegate Hill.
Very much, Madam Chair, and thank you, Chris. So the amendment passed unanimously. The bill had one nay, and I move the amendment.
All right, amendments have been moved and seconded. Is there any further discussion on the amendments? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, do we have a motion on the bill as amended? Second. It's been moved and seconded. Is there any further discussion on the bill as amended? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, who does not want to be on this bill? All right,
I said ma. Make America healthy again.
All right. I love it. House Bill 1042, Health Occupations, Structural Racism Training, Funding Sources, an unfortunate title for what this bill actually does. Lindsay and Rosenberg.
So this bill clarifies the intent of the General Assembly that structural racism training that was required in a bill from last year for renewal of a health occupations license be developed and offered at no cost to the state using funding from external sources, such as the grant provided to the Maryland Nurses Association from the American Nurses Association. There are no amendments. So this was a bill last year. It required structural racism training, and then there was a special section in uncodified language at the end that said it should be offered using grant funding provided to MNA. And this bill is just clarifying that it can be provided at no cost from other external sources other than that particular grant.
Delegate Rosenberg.
So there was no objection, no fiscal note. I would move the bill.
All right, bill has been moved and seconded. Is there any further discussion on the bill? Delegate Shalega.
So remind me what the structural racism training, was that a required, just like the human trafficking one we just had, was that an actual requirement, or was that a may or a shall, or what was that?
That was a requirement. So it was Chapter 478 of 2025. So it expanded the scope of required training for individuals that are licensed or certified by a Health Occupations Board to include implicit bias and structural racism training.
And now we're saying that the state's not going to pay for it.
Well, last year's bill said that it should be paid for by grant funding provided to the Maryland Nurses Association, but because this is not just required for nurses, that it was unclear as to how it might be paid for a program that was targeting other health professions. So other external sources other than state funds could pay for it.
So, okay, thank you.
Delegate Morgan.
Make sure I understand. So it's not going to be paid by the grant. It's going to be picked up by the state taxpayers ultimately, right? No. Who's paying for it?
No, no cost to the state, external sources such as this grant. This grant could pay for a training program, but other external sources
So
could
who's
as well.
paying for it?
Any external source, no cost to the state, such as this grant or anything else that gets identified outside of the state.
I guess
Not
I'm
the
fuzzy on how you take a course and it doesn't cost anything. Who writes it?
It's, so just to be clear, this clarifying language was at the request of some of the health occupations boards who already have been working on this training and have their own resources. But it was unclear if the training could only be created by the nursing board because they were the ones that were identified in uncodified language. That was also an attempt to make sure that we weren't passing an unfunded mandate and last year, to be clear, that it was not state dollars that needed to go to support it. So this is just clarifying that those not state dollars don't have to just come from the original organization that was identified in uncodified language.
the board may be developing this with the resources that they currently have. Is that correct? Okay, well, I'll move on because, I mean, somebody probably is going to ask that on the floor, I would think. So, I mean, we might want to come up with an answer on that. I just, again, think it's odd that we're forcing health officers and doctors, who should be smart, some of the smartest people in the class, in society, to learn about society's fosters racial discrimination by mutually enforced systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice, and making it mandated training for that. Thank you.
And we appreciate that. I mean, I know that last year we had a very robust discussion when we passed the initial bill. This bill also just has an incredibly unfortunate title, given that I think it sort of misleads as to what the bill actually does. Delegate Martinez, followed by Delegate Hutchinson.
I'm good, thank you.
Delegate Hutchinson.
Thank you, Madam Chair. Just curious, though, what if so we mandated that you have to do the training, like it's not an optional one. What if there's not a grant available, like, and they can't find the funding, then what happens?
My mic doesn't work. There we go. The uncodified language from last year said it was the intent of the General Assembly that that training provided under the bill be developed and offered using this grant funding. So this bill is just specifying that intent from last year's bill, that it be provided at no cost to the state using external sources.
So if I heard you correctly, so the nurses grant is out there, and if there weren't other external grant sources that would come from the nurses, regardless of what occupation it was?
I can't speak to that. I mean, as Delegate or Chair Bagnall said, other boards have been working on this using other sources. So I don't know exactly where they're getting the funding from, if it's come from grants or if they were to do it with existing resources. Not sure exactly how they were creating those programs.
Thank you.
Seeing no further questions, we are on the bill as amended, correct? Okay. Oh, there's no amendment. That's why. Okay, so we are on the bill. All in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Delegate Morgan, Delegate Shalega, Delegate Kipke, Delegate Hutchinson, Delegate Riley. Thank you very much. We are now moving on to, sorry, I just want to make sure I'm keeping my notes accurate. House Bill 1047. This is State Board of Physicians Delegation of Duties Alterations. This is Lindsay Ann Rosenberg.
This bill requires an individual to be registered as a limited X-ray machine operator with the Board of Physicians to perform certain X-ray machine operations that previously could be performed without a license, and places conditions on the performance of X-ray duties by a physician assistant. The bill establishes registration and renewal requirements and specifies that if an individual was denied a license by the board, then the individual is not eligible for registration. The term of registration may not exceed 3 years. The bill outlines penalty provisions for violations, and the bill also recodifies provisions related to delegation of duties by a physician to a registered cardiovascular invasive specialist or a supervised medical graduate. There are no amendments.
Delegate Rosenberg.
Read the, and so it was unanimous. Move the bill. Sorry.
The bill has been moved and seconded. Is there any further discussion on this bill? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, the bill passes unanimously. There are no amendments. So we are going to move to House Bill 1264. This is Public Health Maryland Medical Assistance Program Tobacco Cessation. This is Chris Andhill.
This bill requires Medicaid, subject to the limitations of the budget and as permitted by federal law, to provide individual and group counseling for the purpose of tobacco cessation. Medicaid and a managed care organization may not require prior authorization for any product or service for use in eliminating an individual's dependence on tobacco. There was an amendment that added counseling by telephone and clarifies that the prior authorization prohibition applies to products approved by the FDA.
Delegate Hill.
Thank you.
Delegate Hill.
Okay, so the amendment. Right. Thank you very much. Madam Chair and Chris, the amendments passed unanimously. We had one abstained, nay, wanted more information on the vote. Otherwise, it passed. And the questions were, what is the evidence that the state will save money if this is done? And so we have, we both got information, obviously, from the original testimony. If you want to reference the testimony from the American Lung Association, they, let me find the X part. 25% of Marylanders enrolled in Medicaid smoke, and according to the American Lung Association, state of tobacco control healthcare costs attributed to smoking is $2.7 billion. Then they went on to send additional information, and we also have a report, the return on investment of a Medicaid tobacco cessation program in Massachusetts. The study is from 2012. I've asked this to be sent to all the members. So that should be coming around now. And they basically looked at the cost of smoking on healthcare, administrative data indicating that inpatient savings per participant in a cessation program of $571, with a cost of the programs including counseling, pharmacotherapy and outreach is $183. And so therefore, for every $1 the program costs, there's $3.12 approximately in medical savings. So that's the evidence. And Delegate Riley, I think you were the one who wanted to hear that information before you decided whether to vote for or against the bill. I'd like to move the amendments for discussion.
All right, amendments have been moved and seconded. Is there further discussion on the amendments? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Is there a motion on the bill? All right, it's been properly moved and seconded. Is there further discussion on the bill as amended? Delegate Morgan.
Thank you. So, I mean, the entire bill has to deal with this. I'm assuming that the fiscal note is still in effect, that it expands Medicaid indeterminate amount.
Right, and the fiscal note indicates with an expectation that there'll be savings recovered.
Okay. Well, you finding that data, I'm probably still going to vote for against the bill because expanding Medicaid's been a concern. And some of these things, we always say this gets back into the whole point of dynamic scoring versus looking at just a snapshot. Some of the stuff that says, hey, we're going to, every dollar we spend, we'll get 3 or 4 in return. A lot of times that never comes to fruition, but it's good that you have that data, and I appreciate that,
Thank you. Delegate Shalega.
Thank you. Yeah, the letter in here says that it's $7 million over 5 years from the Department of Health. And I support this. I think it's fantastic if you paid for it out of the cigarette restitution fund, because that's what that money was supposed to go for. Would you entertain an amendment to expand? Then it's not Medicaid, it's expansion. You're providing a service out of the CRF that the CRF was supposed to pay for. And I looked it up, how much the CRF gets every year. It's a lot. Let's see if I can find that.
So, I mean, I would certainly entertain that amendment. I think I would defer to Delegate Rosenberg. I think you have some, don't you tend to have the information about what the requirements are on that fund and whether this is tobacco restitution fund and whether this will qualify? I think it would. This would be appropriate.
Preventing teenagers or younger people from smoking is clearly a high priority of the restitution fund.
Well, this is not necessarily teenagers, if this would qualify. It's a sensation.
And cessation is a priority as well, yes.
Okay, so I would entertain, I would second that, if that's a, second it.
Thank you, yeah, and I pulled I found the information. The CRF gets $250 million a year. 120 to 150 is for cancer prevention and treatment. Tobacco prevention programs are 16 million a year. So this is clearly something that fund should pay for.
Madam Chair? Is this something that we need to hold until we get sign off from, I guess, is that managed by the AG, I believe? Is that just the opioid that's managed by the AG?
CRS is managed by the Department of Management and Budget.
Okay, so should we get sign off at
Yeah,
those
so,
funds
so
are
let's
available?
hold this bill with the intent to consider the amendment. But actually, can we vote the amendment and then we'll hold the bill? So let's vote the amendment so that when we bring it back, we can just vote the bill. Does that work for everyone? All right, so the amendment in concept is to amend in utilization of the CRF to pay for this. And it's been moved and seconded. All in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. We're going to hold the bill till we get sign off on doing that and make sure that I don't get myself in trouble. But I think that, Delegate Alston?
Can we go ahead and just vote the bill, so once we get the approval, we don't have to put it on another list?
And we can bring it back if they say.
If they say it's a problem, we can just like undo it
'Cause I
or not move it.
I suspect there are people who won't vote for the bill if can't do it, and they will vote differently. They'll vote differently.
We've got another vote tomorrow. It's okay. We can, we've got some time to figure it out. And what was, Delegate Taveras?
Yeah, no, while I understand where Delegate Austin is coming from, I just think that oftentimes when you have these pots of bills, you also want to make sure that there isn't already a pre-allocation with that money. And so you just want to just cover your bases first.
And I appreciate the intent to move forward. I really appreciate it, especially as we're approaching crossover. But we have time. We have time to just make sure that we're getting it right. So thank you, everyone. We will hold that one, but we have voted the amendment in concept. So we can bring it back for discussion as amended once we get sign off. 1357, House Bill 1357. This is consumer protection menstrual hygiene products labeling requirements. This is Chris and Hill.
This bill requires manufacturers of menstrual hygiene products to include a list of ingredients on each package of menstrual hygiene products sold in the state. The manufacturer must list the ingredients in order of predominance and display the list prominently in conspicuous type. Violation of the bill is an unfair, abusive, or deceptive trade practice under the Maryland Consumer Protection Act, subject to the MCPA's civil and criminal penalty provisions. There was an amendment that makes technical amendments to definitions, adds a compliance date of April 1st, 2028, and removes the penalty under the MCPA and adds a civil penalty instead.
Delegate Hill.
Madam Chair, thank you, Chris. So the amendments moved, the bill moved, no opposition, no negative votes, move the bill as remove the amendment, sorry.
All right, amendments have been moved and seconded. Is there further discussion on the amendments? Delegate Shalega. All right, so they've been moved and seconded. Seeing no further discussion, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, on the bill as amended. All right, it's been moved and seconded. Let's open it up for discussion. Delegate Shalega.
Is this already done? Is that what the testimony was? They already do this? The list that.
They're doing it in other states, if that's
Okay.
what you mean, that it's being done in other states.
Okay, so the national manufacturers were not
tested,
opposed to it?
Right.
And then
They had some small amendments they wanted to make sure it's compliant, but they're doing it in other states.
Okay, and then finally, I just want to, these are only products that are sold. So it's not going to impact like bulk. You know, for instance, the bills that have passed recently to require menstrual hygiene products to be given away, I would assume they would buy, you know, a bulk that wouldn't individually be labeled. This isn't going to impact that, is it?
I think that if they're sold, whether they're sold wholesale or retail, it still applies.
That might be interesting to think about because I was assuming it was a retail, like if the bill that passed today, that's going to put menstrual hygiene products in,
The
or
health
yesterday or recently.
Right.
In colleges, I would assume because it's an unfunded mandate, the college would buy a bulk thing of, you know, menstrual hygiene products. So they would not be individually labeled, they would be in a bulk. So as long as you're not putting that into it, you know, I can support it as well, but we need to make sure that we're not making the colleges then buy a box of individually labeled products.
So it says, include a list of all ingredients listed in order of predominance and displayed prominently in conspicuous types on each consumer-facing package. So, consumer-facing package.
I think Chris has an answer.
This is only applying to the manufacturers. So unless you're manufacturing the actual product, you don't have to list these ingredients.
Delegate Gazzoni.
Yeah, this is a clarifying question. So let's say that they're buying in books. For example, there are products like of this in the ladies' rooms here, and they are individual in the ladies' rooms here. I'm going to assume so long as the big box that it comes in has the ingredients on it, we're good to go.
Right, because that's where you're buying them, is the big, you're not buying them at the retailer individually, and you're not buying
I'm
them.
not buying them at all, but just.
Well, you've got granddaughters. You've got granddaughters.
No, you're missing the point, Terry. You're missing the point.
No, I got that point.
No, I mean, literally, like, you don't want the individual little package to have the information on it.
Yeah. It's yes. I think we're all saying the same thing. Like, it's at the point of the it's the responsibility of the manufacturer. So even if you're buying in bulk, if we're not expecting individually wrapped in the restrooms. I think that, am I correct that that's the concern? Delegate Shalega.
Yeah, I get where she's going. I appreciate and agree with, again, another MAHA thing that we're trying to make people healthy. But just knowing how these products are used single at a time, and you couldn't possibly put everything on that single thing. I'm not sure.
Really, really small.
Then it's going to be super useful. Virtue signaling, if it's so small, you need 2.0 readers to see it.
And I think to your point, that's not the intent of the bill. So we have moved the amendments. We have moved the bill as amended. Any further discussion? This was a great discussion. I feel so seen right now. All in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, who does not want to be on this bill? Delegate Shalega, Delegate Morgan, Delegate Riley. Oh, do we? That is okay. There's no judging. House Bill 1485. This is a public health crisis response system, resources for family members, and trauma-informed care training. Tiara's Law. This is Kristen Hill.
This bill requires MDH to develop a pamphlet to inform the public about the crisis response system, the state and national 988 suicide and crisis lifelines, and programs provided by the state 988 suicide and crisis lifeline. A healthcare provider or representative of the Office of the Chief Medical Examiner must provide the pamphlet to an individual on request or when reasonably appropriate in connection with a death, an overdose, or behavioral health crisis response. MDH must conduct a review of any trauma-informed care training that is provided to healthcare providers, including training regarding family engagement and post-incident support following overdose or behavioral health crises. By December 1st of this year, MDH must report to the General Assembly on its findings and recommendations. The bill takes effect July 1st, and there were no amendments.
Delegate Hill.
So no amendments, unanimous vote, move the bill.
Bill has been moved and seconded. Is there further discussion on this bill? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, it passes unanimously. House Bill 1523. It's favorable. There's no amendment, no amendment. 1523, this is Alcohol, Tobacco, and Cannabis Commission, Unauthorized Consumable Products Enforcement and Seizure. This is Chris and Hill.
This bill authorizes the Field Enforcement Division of the Alcohol, Tobacco, and Cannabis Commission, the ATCC, to issue a citation or other charging document to a person who has committed a violation of Title 21, Subtitles 2D, 2E, 2F of the Health General Article, which are restrictions on tianeptine, kratom, and phenibut. The Executive Director of the ATCC to seize, confiscate, or destroy an unauthorized consumable product that is offered, advertised, or displayed for sale to a consumer in the state as specified, and the district court to impose additional sanctions. The bill further prohibits a retailer from distributing, selling, exposing for sale, or advertising for sale an unauthorized consumable product and imposes criminal and civil penalties on violators of specified provisions. The bill also expands the prohibitions against retailers advertising kratom and phenibut products to minors and requires MDH to notify ATCC of changes in the regulatory status of unauthorized consumable products, including kratom, tianeptine, and phenibut. The bill takes effect July 1st. There were amendments. Amendment number 1, and let me explain. In subcommittee, the subcommittee voted out the packet with the star, but that's different from the packet with the triangle. What I'm going to describe is the packet with the triangle, and I'll let Delegate Hill explain why. Amendment number 1 makes technical changes. Amendment number 2 removes kratom and phenibut from the new ban while leaving current restrictions intact. It revises the defense for violations of those restrictions, and it makes other technical changes.
Delegate Hill.
All right, thank you. Okay, so there really was no controversy in the committee, but it has taken quite a bit of work to get all the moving pieces to agree on the proper language to do what we want the bill to do, which is to put enforcement authority with ATCC without changing what is prohibited or what is banned. And so getting that language right, and so after subcommittee, we thought we had it, had to meet with ATCC again. They asked for some additional changes. Chris and I sat down, put what we thought were those changes in, and then they came back and said, little wording difference here. So you'll see on Delta 1, where it says for a kratom product is greater than the amount permitted under Health General Article 21-2E02. That takes the place of what in the bill said, any plant, any part of a plant, because there are, so we're just, it's not changing the purpose, it's trying to refine the language so that we're more precise about the current law. Okay? So with that, I would move the amendments.
All right, amendments have been moved and seconded. Is there further discussion on the amendments? Delegate Ross.
Thank you, Madam Chair. So there is one more development with this bill, Dr. Hill. But this is, I really think this is a very inconsequential detail. So late-breaking amendment here from the very same commission, a very key stakeholder, which is why I'm bringing this forward. The amendment that they have is all it is, it's just clarifying the definition of unauthorized consumable products, which I know you're also working on and previously with some of those prior amendments. This is just, it's clarifying, there's a section, I can read it if we need to approve it, can vote on it in concept. It's on page 4, I can explain what it is. It's line number 18, when under the definition of unauthorized consumable products. Which packet? Oh, boy. Yes, it is the reprint, I'm sorry.
So here's what I'm going to do.
Yeah.
I'm going to let us have the discussion so that we understand the amendment. We do have another voting session tomorrow. So we will hold this bill today, but we'll have the discussion today on the amendments for tomorrow so that we can just put it on the vote list. So Delegate Ross, and then we'll go to Delegate Riley and Delegate Gazzoni.
Thank you, Madam Chair, and that makes it perfect, actually. So I can go through this. It's the reprint. It's on page number 4. And if you go to line 18, when there's the definition of unauthorized consumable products, tianeptine is fine. Under kratom, it goes into some very lengthy detail. Page 4. It's page, thank you, page 4, line 18.
But page 4 to page 6 of the report.
Page 6, yes, sorry. Page 6 of the reprint.
Which packet? I didn't have
Yes. Okay. See, you know what, here's the problem. I don't have any of those things. The triangle's not here. I don't have those things, that's why. All right, so are we all there? Yes. Okay. So page 6, what line is it actually in you guys' copy? I have a different one. So it's going to be line number 18 still, 17 and 18. So when it goes into the definition of what's an unauthorized consumable product, everything here is accurate, but it's lengthy. So it's going into all of this cross-reference to the article, the Health General article, and the recommendation from ATC is just to clarify it and just simply say, instead of saying a kratom product as defined in 212E01 of the Health General article described in, that everything after that simply say, a kratom product as defined in 212E01 of the Health General article that does not comply with subtitle 2E of the Health General article. And then for phenibut, instead of all of the descriptive detail, it just says a phenibut product as defined in 212F01 of the Health General article that does not comply with subtitle 2F of the Health General article. So it's really just a simplification of the very definition you see here. It is not a material change. I consider this to be a friendly amendment. This aligns completely with the intent from the beginning, which was just to say that kratom and phenibut are only unauthorized consumable products if they are not compliant with the current law.
So on page 4. No, I know, but on the triangle, on the start. Sorry, man.
Delegate Gazzoni, followed by Delegate Riley, or did I call it the other way before? Delegate Gazzoni, followed by Delegate Riley.
Delegate Riley. I just want to confirm that what we've done is, in the amendments, addresses some of the information we got from some of the kratom people that said, hey, this kind of kratom is okay, this other kind is not. It leaves the okay stuff still okay.
Yes.
Thank you, just wanted that clarification.
Yes. Being so hard.
Yep.
To get the wording right.
Before coming in here, and she said this particular amendment from ATCC also reflects their final concerns too.
Just wanted to confirm, thank you very much.
Delegate Riley.
Thank you, Madam Chair. Yes, so I confirmed that earlier with Chris, so thank you for that explanation. So are we still, I don't know, so on here, so the 70H that we figured out in testimony, that was the deadly supplement. So is this legalizing that deadly supplement, and is that what they're going after when they go to these?
Delegate Hill.
So we are not changing the legal status of any of it.
Okay.
And in fact, the original bill inadvertently did. And what we're working very hard to do is to make sure that the legal status of 70H and everything else that's already, the things that are prohibited are prohibited.
Okay.
The things that are restricted to those over the age of 18 are still restricted to those over the age of 18. And that we're clear about what that means, and now there's authority to do the enforcement.
Okay, because those items were technically already
Correct.
banned,
Correct.
but they didn't have the authority to go in and confiscate
And
them
on
and seize them.
Delta reprint, page 7,
Yep.
if you
Okay.
turn, which is the bill, page 5 of 13 on what you guys are calling triangle and I'm calling Delta. And if you look in that, lines 11 through 17, the kratom, whatever we want to call it,
Yeah.
was on, that had, in the original bill, that was suddenly completely prohibited.
Right.
But now it's not. But the 7-hydroxymitragynine is, okay? And then this other line about a kratom product, that's already forbidden, so it references that. And it talks about the amount of it. The previous language talked about if it comes from a plant. Well, it all comes from a plant.
Right.
Both the stuff
So
prohibited and the
apparently,
stuff not.
now
Right.
with this authority for clarification, they can go into these establishments that are still continuing to sell it and confiscate it, seize it.
It, if
Right,
it
the
has
current
too high
law.
a concentration.
Okay.
or
And that's
they're
on the
selling it,
label.
Right, with adulterated with other
Okay.
items,
Yep. All right.
or they're selling it to minors.
Okay, thank you.
Thank you.
All right, again, we're on the amendment. We're going to hold this bill for the voting list tomorrow, just so everyone can process the information that we've just received and confirm, with the proposed amendment that we want to make sure we get it right. Because as we know, these products are a little bit like whack-a-mole. Like we keep having to come back. So we're going to hold that bill. Thank you very much, everyone, for a great discussion and vote session. And this concludes our vote session for today. Go ahead and let me know when we're down.